Joint. A joint is a connection or junction between two or more bones or cartilages to permit movements. The number of joints are higher in children than in adults. The articulating parts differ among bones. The long bones articulate at their ends, the flat bones articulate at their margins, while the short and irregular bones articulate at their articular surfaces. Now, let us see the classification of joints. According to the material binding the bone, we have the structural classification that includes fibrous joints, cartilaginous joints, and the synovial joints. According to the range of movement, there is functional classification that includes synarthrosis, amphiarthrosis, and diarthrosis. The synarthrosis are immovable joints. The amphiarthrosis are slightly movable joints, and the diarthrosis are freely movable joints. According to the number of articulating bones, they can be simple joint when only two bones articulate, compound joint when more than two bones articulate within one capsule, and complex joint when the joint capsule is divided by an intra-articular disc. So, in this video, we will discuss the structural classification of joints in detail, starting with the fibrous joints. The fibrous tissue will be binding the articulating ends in fibrous joints. These are solid joints without joint cavity. They provide stability and protection. So, the fibrous joints include sutures, syndesmosis, and gomphosis. Sutures. They are present only in the skull. They are immobile joints holding the skull bones together. Based on their margin shape, they are classified as plain, serrate, squamous, denticulate, and syndaclous. Now, let us see the examples for each of these. The internasal suture is example for plain type. The coronal suture that is present between the frontal and parietal bones, and the sagittal suture present between the two parietal bones are examples for the serrate type. The temporoparietal suture is example for squamous type. The lambdoid suture present between the parietal bones and occipital bone is an example for the denticulate type, and the example for syndaclous type is the joint present between rostrum of sphenoid and upper border of vomer. Next, we move to syndesmosis. Here, the surface of the bones are united by fibrous connection, most commonly by interosseous ligaments. Slight degree of movement is possible. The examples are inferior tibiofibular joint and middle radioulnar joint. Then the last type of fibrous joint is gomphosis. These are peg and socket joints. The peg-shaped process gets inserted into a socket and is united by the fibrous tissue. The example is the root of the tooth in its bony socket. Then the cartilaginous joints. In this type of joints, the bones are connected by cartilage. The two types of cartilaginous joints are primary or synchondrosis and secondary or symphysis. In synchondrosis, the bones are lined by a plate of hyaline cartilage. At certain age, the cartilaginous plate is replaced by bone. That is, it gets ossified. They are primarily designed for bone growth. These joints are immovable, strong, and temporary. The examples are joints between epiphysis and diaphysis of a growing long bone, that is, the epiphyseal plate, costochondral joint, and spino-occipital joint. In symphysis, the articular surface is covered by hyaline cartilage and is united by a disc of fibrocartilage. Typically, it occurs in median plane of the body. Hence, they are also called as midline joints. They permit limited movement due to compressive fibrocartilage. The examples include manubriosternal joint, intervertebral joint between the vertebral bodies, and pubic symphysis. Then, moving to the synovial joints. These are freely movable joints that allow wide range of movement. They are mostly the joints of the appendicular skeleton. The articular surfaces are covered by cartilage and ligaments holds the bones together. The different types of synovial joints are gliding, hinge, pivot, condylar, ellipsoid, saddle, and ball and socket joints. The structures of the synovial joint include the articulating bones, articular cartilage, articular capsule, synovial membrane, joint cavity, synovial fluid, articular disc, accessory ligaments, and bursae. So, that wraps up a high yield overview of the classification of the joints.